Hi, everyone. It's Jacqueline Novogratz, here to read an excerpt from my new book, Manifesto for a Moral Revolution. I will be reading this. I will be reading excerpts from each of the chapters um, on weekdays until May 26th. I wrote this book really as a love letter to anybody daring to make change in this fragile, fractured, yet ultimately beautiful world of ours. Um, and as I read these chapters, I remind myself not only why I read and wrote, why I wrote the book, but also um, what I really mean by these words moral revolution. And increasingly, for me, moral cannot be about a set of prescribed rules or truths handed down from some higher authority, but rather it's in holding the opposing values that we all have. We want our health, we want livelihoods, we want to thrive as individuals. We know we do better when the community thrives. Um, we know we need financial sustainability, profitability for a company to operate. And yet, it only makes sense in an interdependent world to do so in the context of a better environment for all of us in ways that protect and reach the most vulnerable. And revolution cannot come from above or below, but must come from within. Today, I'm going to talk about the principle and the practice of accompaniment. Accompaniment is a Jesuit term, essentially, that means to walk alongside, to hold a mirror to one another, to help someone see sometimes what they can't see inside themselves. The Indian economist Amartya Sen spoke about the need for markets, but also that access to markets is a form of freedom. I've already spoken about the need to use markets without being seduced by markets. But what it means by access to markets as a form of freedom presupposes that for people to use the access that they have, to use opportunity, they must build capabilities. And that's hard. And it's particularly hard if the whole world has told you that you're not worth very much. And that's where the spirit of accompaniment comes in. In this moment of the coronavirus crisis, every single one of us has an opportunity to accompany just one other person, whether it be an older person who needs food taken to them, someone who's lonely or feeling a sense of despair. This is a moment to help them see the light inside themselves that they might not themselves see. So, accompaniment. It's one of the most critical ideas, frankly, not just for building more inclusive enterprises. I actually think it's an idea on which we can build economies. When we think of building back better after this time of coronavirus, in every country, how would things look differently if we took very seriously this idea of accompaniment and integrated it into our economic systems, our political systems, and our social systems? So, a few different excerpts out of chapter 11 accompany each other. And as I read, as questions come to you, please put them in the chat. And at the end, I will try to answer whatever we have time for. And thanks for listening. Accompany each other. In 1987, while I was building Duterembere, I also helped a group of unwed mothers transform a charity project into a bakery business. I recognized that too few micro-entrepreneurs in Rwanda employed people beyond a couple of family members. So I decided to try my hand at building a business. Foolishly foolishly assuming the endeavor would be easy. The women already knew how to bake, and there was a ready market in the fancier offices in town. Moreover, there was no real competition at the time. But in the beginning, no matter how hard I tried to make things work, we failed. The women didn't show up on time. They stole from the bakery. They were too fearful to knock on office doors and introduce themselves, looking at the floor when anyone spoke to them. The women had few marketable skills, no trust, and little entrepreneurial drive. It took a while to identify the entanglement of forces that kept these women from taking advantage of this market opportunity. They were from poor families, and most were illiterate and unskilled, divided from mainstream society, and divorced from their own sense of self-worth. So-called respectable people kept their distance from such poverty, referring to the poor women as prostitutes and seeing them as second-class citizens at best. The poor and vulnerable continually suffer from poverty's many forms of violence. Dangerous physical environments, miserable schools, inadequate health care, and untrustworthy courts. In turn, many poor and vulnerable people inflict a further sense of unworthiness on themselves. I began to understand what Rousseau meant when he wrote in The Social Contract that man is born free, yet everywhere he is in chains. Intuitively, I adjusted the role I played, no longer simply a manager, but a coach, a cheerleader, a friend. Each Friday, I'd hold sessions to teach the women how business worked in ways that connected to their realities, not mine. We practiced saying hello to strangers. I joined them to try to convince shopkeepers to stock our baked goods. I was at the bakery most mornings when they arrived, and we celebrated small victories together. And sometimes we laughed, joyfully and boisterously. Their challenges in the bakery became mine to solve, not for them, but with them. Though frustrated daily, I found that I liked the person I was when I was around these women. I discovered ways to hold a mirror to their inner beauty and potential, and they reflected back to me the best parts of myself. Appreciation revealed itself in an unexpected smile, a hug, or a collective cheer when our sales finally began to creep upward and the number of stolen goods declined to zero. In time, yet our shared journey was more than one of mutual gratitude. In time, the women began to earn more than most of their peers while building a business, seeing steady income, and establishing self-esteem. Finally, they had unearthed a sense of dignity inside themselves that no one could take away from them. Without knowing it, I was learning to practice the principle of accompaniment. Accompaniment is a Jesuit idea, meaning to live and walk alongside those you serve. It is the willingness to encounter another, to make someone feel valued and seen, bettered for knowing you, never belittled. Guiding another person, organization, or community to build confidence and capabilities requires tenacity, a disciplined resolve to show up repeatedly with no expectation of thanks in return. This kind of accompaniment requires the patience to listen to others' stories without judgment, to offer skills and solutions without imposition. It is to be a follower as well as a guide, a humble yet aspirational teacher-student, focused on coaching another with firm kindness and a steady presence. With those you aim to serve or lead, your job is to be interested, to help make another person shine, not demonstrate how smart or good or capable you yourself are. Accompaniment is especially important when partnering with those who are from places or families that have been traumatized or marginalized by war, violence, isolation, aggression, or by drugs or generational poverty. Accompaniment recognizes that for many individuals and communities, spiritual poverty is as devastating as material poverty. The simple act of showing up and connecting with another's humanity can help a person rekindle hope in ways they might not otherwise have dreamed of doing. Think of someone in your own life who saw the best version of who you could be, even when you couldn't see that version yourself. That person could be a parent, sibling, mentor, teacher, coach, or boss who dared you, pushed you, equipped you with the skills to succeed. A friend who told you hard truths constructively, perhaps with toughness, but bolstered with determined love, all with the end result of making you feel bigger, more awake, more here. If you can think of just one person who accompanied you like that, consider yourself lucky. Now think of the people who feel left out, those living in poverty, in conflict areas, sitting in prison, or struggling in refugee camps. Many in those communities are exposed to endless callousness and constant criticism. Often they internalize the perceptions that others impose on them, that they are predatory, parasitic, unfit, unworthy, or invisible. Despair is not the singular domain of the poor. For all of us who have suffered unimaginable loss, or who are in crisis or physical pain, just getting out of bed can sometimes be an act of courage. For anyone experiencing loneliness or despondency, there is great power in knowing that while you have to do the hard work of change yourself, someone out there has your back. Accompaniment is a way of upholding your commitment to another's success. After her year as an Acumen fellow with a Rwandan coffee company that purchased beans from some of the poorest farmers on the planet, Australian-born Ramya Warren accepted a full-time job with the company, running operations while the CEO negotiated contracts with specialty buyers and maintained a more external presence. Ramya loved working with the farmers and took great pride in being a female leader who supported women to lead themselves. Sadly, that coffee company ultimately failed. While investors, including Acumen, focused on what it would mean to shut it down and do what was necessary to repay creditors, Ramya turned her attention to the 300 smallholder farmers who had lost their livelihoods. Despite her own exhaustion and working without a paycheck for months, Ramya stayed on the job until every farmer felt secure and connected to a new company. I will never forget my phone conversation with her. I was walking down a blustery New York City street while Ramya was up late in Kigali. While the company is operational, she told me, the best thing I can do for investors is to ensure a fair and profitable company. But with investors out and the company shutting down, she continued, I have to focus on the farmers. Isn't that what we mean when we commit to standing with the poor? The bankruptcy wasn't their fault. They are the most vulnerable stakeholders of all here. When faced with excruciating decisions involving divergent stakeholders, I call to mind and am inspired by Ramya's fierce determination to accompany the farmers. She had no financial cushion, and she was living in a foreign country. Yet not for a minute did she allow the situation to be about her. Ramya was there to accompany the farmers, to stand with the poor so they could carry on with their prospects intact after the company that had supported them and trained them collapsed. In times of both success and failure, we can choose with whom we stand. Going beyond yourself to enable others not just to persevere, but to thrive lies at the heart of accompaniment. 21st century capitalism rewards money, power, and fame, not the immeasurable impact we have on a person's confidence, their courage, or their ability to, say, remain in school or make it through another day. This failure to recognize important work imperils us all. By rewarding only what we can measure, we perpetuate systems that fail to honor that which we value most. And the price we pay is nothing less than our collective soul. But we can choose to build new systems grounded in a moral framework premised on the belief that we are here on earth to serve others and to sustain our planet for the next generation. That starts with the simple, dedicated act of accompanying each other. At a time when elements of the developed and the developing world exist in every country, the principle of accompaniment is universally relevant. As countries become wealthier and more unequal, they inevitably become more individualistic and fearful, breeding grounds for isolation, loneliness, and mistrust. Many models of accompaniment in the developing world are based on the understanding that people yearn to belong, to be cared for, and that individual communities thrive when they are parts of larger communities. In other words, human beings thrive when we believe someone cares about us. It isn't much more complicated than that. During the HIV/AIDS crisis in Africa, many organizations employed a community healthcare worker model, or CHW, enlisting and transforming ordinary community members into health workers who accompanied their neighbors. The CHWs would show up at the homes of HIV-infected patients to make sure they were eating correctly and taking their medicines. The best of these health workers emotionally accompanied the ill, making them feel seen and worthy. In turn, the CHWs become valued members and leaders of society. Mamik Kaur, an American daughter of South Asian immigrants, worked both in South Africa and India, where she experienced the CHW model firsthand before returning to New York City to pursue her MBA. In 2013, she founded a company in Manhattan's Harlem neighborhood called City HealthWorks, which aims to integrate CHWs and coaches into the U.S. healthcare system. She'd seen unskilled South African women receive a few months' training and then support patients with HIV, often with remarkable results. Why couldn't residents serve as peer counselors in the States, she wondered. In Harlem, as in much of the United States, significant members of residents suffer from chronic diseases such as diabetes, asthma, and hypertension. Manmeet reasoned that partnering directly with these patients could help them model their lifestyles and provide companionship while also saving the government and insurance companies a considerable amount of money. On another wintry January day, this time in 2017, I went to City HealthWorks to visit a local health coach named Destiny Belton, an African American whose uncluttered attire, black pants, a red sweater, and stud earrings, and pulled-back hair were paired with a straightforward personality. Personable, smart, and matter-of-fact, Destiny spoke to me as if we were old friends while we walked to a colorful community center in Spanish Harlem. Inside the center, we passed a gym full of young boys playing basketball, and then a dance hall where older men and women were dancing salsa. Finally, to arrive at a room filled with 30 women and 3 or 4 men playing cards, or bingo, or mahjong. A petite elderly Chinese woman walked from table to table offering oranges and powdery cookies. We joined a group of Black and Latina women who were gladdened to see Destiny and who welcomed me warmly. We talked about our lives and what it felt like to be clients of City HealthWorks. Maria, wearing a wool cap and holding a cane, spoke about how much she loved feeling part of something. Destiny takes me to the grocery store and teaches me how to shop for healthy food, she said. I appreciate that. These people know what they're doing. We go on walks, and Destiny checks in on me to see that I'm taking the right meds. Whenever I have a problem, I just call her. As Maria spoke, the other women at the table nodded their heads in agreement. But are you healthier? I asked. You bet I'm healthier, Maria explained. I've lost weight and I feel good. It's been a long time since I had to go to the hospital. I turned to Destiny and asked for her reaction to so many compliments. It does make me feel valued, she responded. I had a dead-end job before this one, just working in retail, but now I'm being trained. I'm contributing to the community and my family. I asked Destiny what she appreciated most about her job as a health coach. I teach the women how to do better at eating and shopping, she said, and they appreciate it. Some have a better sense of hope now. They've been suffering from the same diseases for so many years, and now they are seeing for the first time that they can feel better if they manage their issues. Has seeing the women changed you? I asked. I feel more important now, and my own eating has also improved. Why do you think your eating habits have changed? If you're the coach, you'd better practice what you preach, Destiny responded. Being a coach is helping more than my patients. It's helping my whole family and some of my friends, too. I realized as she spoke that in teaching one family member how to take better care of their health, Destiny was helping extended families, including her own. As Manmeet later explained, we teach our health coaches to start by asking 3 questions of their clients. What are your fears? What are you struggling with? What motivates you to live a longer life? After a couple of visits, clients might disclose more sensitive struggles that are contributing to their poor health, whether they fear taking their medicines or are too ashamed to go to local food pantries. The health coaches learn to listen, and the coaches feel seen because our coaches have similar life experiences. People from vulnerable situations are not just defined by their situations. They have individual and collective strengths. As for the health workers, Mamir added, some have told her that they observe themselves leveling up, acquiring new skills, and believing more deeply in themselves because the company assumes that they can do more than they imagined for themselves. City Health Works now has accompanied more than 2,000 clients in Harlem and is taking the model to other parts of New York City. Manmeet has proven that the model lowers overall health costs, securing state contracts that will allow her to build a profitable company. People sometimes ask how accompaniment scales as a principle. I would say that how we support one another is an ethos, a way of seeing others and ourselves. If we spread that ethos, and if we celebrate those who do it well, then accompaniment and the benefit from them will only increase. Accompaniment is not only for a business or an organization. It is a framework for a more inclusive, caring society. Wherever people feel lonely, isolated, or anxious, there is an opportunity to prevent chronic disease, to support the elderly, to take care of the very young, to help the sick and suffering, to help prisoners feel less alone, and to enable the formerly incarcerated and drug users to get back on their feet. All of us will at some point need to be accompanied. All of us have the power to accompany someone else in need. Accompaniment. It sounds like a softer practice. And as all of us who have accompanied or been accompanied, we know it's a very hard skill. So thank you for your questions, lots today. How do you see Pakistan's response to COVID-19, especially in terms of creation of public-private partnerships? Any Acumen Fellows who has come up with an innovative idea to counter the pandemic? Well, yesterday I shared a story from Pakistan of Abdal in education, who's working with a Pakistani fellow named Haroon and another named Danyal, who are bringing EdTech together with cable television and radio to really bring education to young people, and that's important. One Pakistani fellow who actually works with more of an accompaniment model that has been so interesting because it really is releasing the energies of so many different types of people is a woman named Sarah Saeed Kuram. Now, Sarah had built a company called Sehat Kahani. And Sehat Kahani started out with a series of private clinics connected to doctors, women doctors, most of whom who had married and stopped actually practicing. But again, here's where the technologies that we have today offer such an opportunity. So these women doctors would provide consultation to village women using telemedicine, but those women were accompanied by health workers at the clinics. Separately, she built an app so that people could have consultations online on their smartphones. Well, she had 26 private clinics up and running when lockdown was declared. And part of the lockdown was that private health clinics were closed because the government was afraid of people congregating. And so now what do you do? Particularly in a culture, which is most low income cultures, where there's very little trust of apps, because you want to get a doctor to see you physically and probably give you a pill if you're going to pay. And so Sarah decided, since she had this app, that this was a moment to act and then figure out how to make the company profitable. And so she declared that all she had was now the app, but it was free during COVID. And she saw her online consultations jump from 50 a day to nearly 1,000 a day within a matter of weeks. And so she reached out to 2 other stakeholder groups, other doctors across the country, including doctors from other countries within the Pakistani diaspora. And she needed government's permission and approval to allow those doctors to provide consultations inside Pakistan. And very quickly, in a moment of crisis, the government of Sindh, which is one of the provinces, agreed to work with her. And I'm watching young entrepreneurs literally reinvent in a resource-constrained environment, recognizing that we won't solve our problems in our silos. We must solve them systemically. And that as we build back better, it is this art of pivoting quickly in service of our mission and the customers who are vulnerable, and reaching out to partner not only with the private sector, civil society, but government, so that we can actually solve these problems and not just either talk about them or solve them in a way that is subscale. So really exciting to see what is coming out of what's coming out of this situation. How can we tell when someone might need our accompaniment versus someone else type of support? That's a great question. This is where I think that part of moral leadership, the moral imagination, is a mix of audacity and humility. The truth is, sometimes you're the only one there. And if you show up, you got to step up to the occasion. In understanding and starting by listening rather than assuming that you have a solution for someone else. What you might find is you've already done the work you came to do just by listening, and then hearing from that other person what they actually need. And it often isn't you, but being that link, whether it is because they have an emotional problem that is over your head and they actually need professional support, and so you help them find it, or in a more tangible way, they're unable to solve a technical problem that you're probably not the best person, or you may not be the best person to solve. And so it starts, like so many of these practices, with deep listening, not just with your eyes, but with all of you, because sometimes you have to listen between the words to what people say. I found often with young builders in the nonprofit sector, the for-profit sector, that when you ask them what they need, it's often, I need money, I need cash. Listen harder. Ask the questions in ways that push them to find other solutions themselves. And sometimes you have to get out of the way then. At Acumen, we have something called the one-armed hug. And by that we mean put one arm around someone. But at the end of the day, they have to solve their own problems. You can accompany them, walk with them, help them, but you can't solve it for them. So accompaniment, one of the most important principles and even more important practices, not only for this moment of crisis and isolation and loneliness and too much fear, but as we build back, because I fundamentally believe this could be the foundation of a more caring, service-oriented economy that could provide jobs, even as we help rebuild the inside of ourselves and not just our external infrastructure. Thanks everyone for listening. If you buy the book, here's my big sell. If you buy the book before May 26th, we actually have a master course online at Acumen Academy /Moral Revolution called The Path to Moral Leadership. And I teach it along with amazing entrepreneurs and team members at Acumen over a 12-week period. It normally costs $200. But if you want to be part of this movement and you buy the book, the course is free as long as you sign up before May 26th. Otherwise, I'll see you tomorrow, and thank you so much for showing up and accompanying me.